The doctor, or Michael's urologist, was excellent with regards to giving Michael and I time to ask questions. He told us what he would recommend and what he was going to do then once Michael decided to go with the operation. He also said, have you got any questions? He didn't shoo us out. I was really pleased that he gave us time to ask questions that were bothering us or worrying us. And then he said, do you have any children? And we said yes. And he said, well, the next appointment, I'd like you to come with them. And he more or less went through the exact same thing in front of the kids and then said, now, do you have any questions? So he was wonderful, giving us time to ask the questions. And very bluntly, he said to Andrew, because you're Michael's son, you have to be tested from age 40 onwards. And it's up to you to do it. So I was very pleased that the doctor said that and that I wouldn't be the mother nagging him to have it done.
We asked for another opinion and we went to another doctor whom Jerry liked and he felt very comfortable with. And that's important too, that you get a doctor you feel you can talk to.
The decision making basically is left up to the person. The doctor gives you all the options, but he doesn't really give you a defined answer at that point in time in our life anyway. The second doctor was a little more direct because by then the numbers had crept up a little bit more. And so he said he really didn't have much choice. It was either go for the radical prostatectomy or go into the radiation or another form of treatment.
I left it up to Michael. Whatever he decided to do, I was willing to go along with it. My initial reaction, internal ones, were ones to go and have it done ASAP. But he wanted to go and do a lot more research as to the various avenues that were open to him. And he went down to Princess Margaret for a day, and he wanted to go alone. He didn't want me with him. So he went down there, in fact, trying to find out what all the different avenues were open to him that he could avail himself of. And after a lot of research, then he said, I'm going to have it out. And I said, when? And he said, after our son's wedding, because our son was being married in the October, and this was the June, and he didn't want to do anything about it until after our son's wedding. He didn't want to ruin their big day.
The decision making was difficult because he was choosing watching and waiting, where my daughter and I, who is a nurse, really wanted to have a second opinion and get more information on how this could happen. And so finally when we got him to agree for the second opinion, and he saw that he really needed to take some action then, we thought could have provided us with more of a concrete answer so we knew which direction to take. But when you think back, the way they do it, it is a good choice, leaving it up to you, because if you take the wrong one, then you can blame somebody, whereas if you go with what you want, then it's up, your decision is your decision.
I didn't know very much about prostate cancer. I didn't know much about the actual prostate. That I learned when Ron was diagnosed with prostate cancer. And I learned it from reading books written by doctors with the visual pictures in them. I didn't realize what its purpose was, the prostate. Didn't know anything about it. I knew there was a prostate, but I didn't know what its purpose was in the man's body. So I learned that.
I just asked a lot of people who were in the medical field a lot of questions. I asked the new GP about it also, and he said, do you need to go and talk to anyone else? And I told him what I'd done. And he says, well, I think you've covered the bases then. Anytime anyone has come up to me and said, oh, my husband's been diagnosed with prostate cancer, I always tell them just, educate yourself, find out more about it, do a lot of reading, go on the internet, basically things that I had done, and ask a lot of questions.
Learn all you can about whatever treatment the husband or significant other is going through, what to do for it. I think information will help you. There's no question. There are support groups to go to, which I think are wonderful. There is internet, but you got to be careful not to get outdated information. And just be encouraging. Don't be down, because if you're down, you're going to pull them down.
I went to all his appointments with him. I sat in the room because an extra pair of ears is very beneficial. When you're the patient and you're going to be facing something as serious as this, often you don't hear everything. So I would suggest that as couples, they go together and go into the office when the doctor is speaking, and for the spouse to take a notebook and keep a record of things that have said, because you won't remember after you come out of the room, and your husband will remember even less than what you've heard.
We would go to a support group, which we did, which was very, very helpful, and I really stress it because most of the men that are at least have been there and done it and have been able to give good advice, as we are now doing to people coming into this group.
I found them really, really good. The sessions there were very educational and beneficial to me. So I've always encouraged people to go there. I'm sure there's other places that they could go to, but this is the one we found, and both of us really find it very beneficial.
Don't read everything on the internet that you can find. Look for the books that the doctor recommends for you to read. And we have passed our 2 books along to many, many people for them to read, to get a feel of things and what's out there.
Yes, it would have been very good to have more information beforehand, but then again, you get so much information that you're in overload and you really don't know what. Sometimes it's better not to have too much information, just the main central facts.
The knowledge about prostate cancer, we hadn't got that much beforehand. I had a little bit because of my father's exposure with it, but we sort of, when he was diagnosed with, we sat down, we said, this is what we're going to do. We're going to try and find out as much as possible. So I think we covered the bases once we knew what we're dealing with. I can't say that I wish that I'd known these things beforehand. No, he told us what the negatives were, what the positives were, what to expect and what to do, you know. So I think we were both educated before the operation as to what to expect. So we didn't have any horror stories after the operation.
The effects of the treatment were quite easy in some ways because as they just go along with what the doctors tell you. And at first it was a shock because we didn't really understand all the effects that could come by. And when we first visited the doctor, they tell you so much information, you don't really retain it all. So it was kind of sit and wait. That was his choice, was sitting and waiting, because of all of our friends having had really bad experiences with prostate cancer. So it was kind of scary to think that these things could have happened to us. So it was kind of watch and wait for a little bit.
Doctors we find today still are not talking about side effects. I don't call them side effects, I call them effects, because most men will have impotence, incontinence, and shrinkage of the penis after surgery.
After the surgery, the doctors and the nurses really didn't give us a lot of specific after effects. I mean, we knew going into it that there could be the incontinence, and then it could be the sexual life could have been changed, but there was nothing concrete, and the nurses, of course, never said anything.
Derek has been through many sides of the treatment. Initially, it's the body, the muscles, loss of muscle over the years. Now he can't do anything really, really strong, like he hasn't got any muscle power at all. And of course the enlarged breasts, that was not nice for him. You know, they lose their body hair and chest hair, and it came to us one day when he wanted to do something. Like he's always been a builder of decks and sheds and whatever we had to be done, he's there doing it. And he decided to go to our big shed and get something out that he wanted to do. And as he went out, he saw our next door neighbour sawing away doing his woodwork. And when he went into the shed, he found out that he couldn't do what he wanted to do. And it was the first time I'd seen him crying, coming back. And we both sat on the deck having a little cry and a hug. And, you know, that is one of the side effects.
The hardest thing to go through with the whole thing was, I guess, waiting in Trillium from the time Michael was taken away until I could actually see him. It wasn't, I can't remember the length of time, but it seemed like an eternity. And I brought a book and I read the same line, I don't know how many times. I couldn't settle on anything at all, because your mind just takes over and you think what the worst outcome of the operation is, you know. And I think that was it, really, waiting in the waiting room for the operation to be over.
I told the doctor the next day when Ron was having his stitches out, and sure enough, he did have a blood clot. So that was another thing we had to cope with. He had to have the needles here, and it was a long weekend. He had a couple, and then we would have had to gone to emergency over the long weekend, and my son said, "Mom, I think you can do that if I phone you and walk you through it." So I did. On the Saturday morning at 8 o'clock, he told me exactly what to do with that needle and that little vial, and how to put it in, and I did. And then again on the Sunday, and after that, I kept putting it in. Of course, Ron was on blood thinners for 3 months after that, and because he'd had the blood clots, just as a safety precaution.
We put vitamin E cream on his incision, and we were careful to watch there was no infections. And he healed very nicely. He's got a scar now, like I do from my C-section, so we've got a match set.
Incontinence was a worry, but again, if you have to know, Ron and I, that we just face things head on. And, you know, if that's what it is, we'll just face it when it comes to it. And if you have to wear a light pad for the rest of your life, then that's what we'll do. We're alive, and you're alive. And I've had a lot of surgeries myself, so I guess that's how we cope. We know what to expect.
Last year, had the problem with his heart, which is one of the downsides of the hormone treatment, the fact that it can affect your heart or a stroke. But I mean, anybody can have that anyway, but I mean more so with hormone treatment. And last year was the first instance in September when he had a problem breathing when he was down in Toronto. And consequently, he was in Newmarket Hospital for a week, and where they went up to the heart and did whatever they had to do. And he's being a person who's never exercised. He would sometimes, years ago, I would come home and he wouldn't be around. There'd be no note, nothing. And he's suddenly gone off around the block, the big block. And I would be worried, silly, wondering where he was. And he's doing fine now, and he's actually signed up with the cardiac for treatment and for their exercise for 6 months. 6 months, yeah. And so he goes religiously every Tuesday now to the tannery, and he's walking 2.5 miles in 35 minutes, and it's amazing.
Once Michael got over the operation and he could go out for a short walk, he just couldn't believe that he couldn't walk that far. So we went out every day. We made a point of going out for a short walk, and then a bit further and a bit further. So once he got over the operation, he slept a lot, which we knew would be expected. So we just changed our lifestyle to accommodate his situation. And then once he was feeling stronger, things went, you know, every day it was a little bit better. It's like any operation. You just have got to take it day by day. And you do have a day that he thought he could maybe go further and he couldn't, and we had to say, well, you stay here, I'll go back and get the car and bring it back, you know. But that's part and parcel of understanding someone else's emotions and feelings, and you've got to be there for them.
My husband went right back to his work, and his whole attitude is, you just keep going and you do the things that you have to do. And even when he was off recovering, his work is here in the home, so that he can still go on his computer wherever in the house he wants and do what he had to do. But basically he left a a lot of it sitting, and he took time to read and sit in the hammock the kids had bought him so he could relax. But he did obey the doctors completely because he knew he had to do certain things if he wants to recover.
Michael's health has changed for the better. He's more aware of what he's eating, what he's drinking. So I think this brush with cancer has educated him to think more about what he's putting into his body. So I think from that aspect, the cancer actually was a good thing in one way, if you can say that the fact that he's been able to re-educate himself and eat better.
I think the most difficult one was, like, he was diagnosed in 95, and 2005 was when we found out that the cancer had metastasized to his spine and he had to go for back surgery. And if he was not operated on, he could be paralyzed, and he could still be paralyzed if he was operated. So he decided, he's always been very, very positive and had a very good outlook. And so whenever anybody asks him how he is, even if he's not feeling so good, he'll say, fantastic. Me, I'm the other way, I'm the negative one. But my daughter and I were down at the hospital seeing him being taken in, wheeled in. And he was surrounded by these lovely nurses and giving them big smiles, and the doctor. And our daughter said to the doctor, take out everything that is necessary, including his brain. And but that turned out to be very successful. So that was another hurdle passed.
Well, the primary caregiver needs to be willing to help encourage them and make them the forefront so that they know that they are still a man no matter what the effects of the surgery and the long process it takes to recover, because it isn't something that's going to go away in a month or two. It's going to take a long time to recover, whether it's full recovery or partial recovery, whatever. But they need to know that you can accept them the way they are, and you still want to encourage them and love them just as